वेलकम बैक नाज़रीन टू द सेकंड हाफ ऑफ आवर प्रोग्राम। आज का हमारा प्रोग्राम एपिलेप्सी के बारे में है और ब्रेक से पहले हमें डॉक्टर मानी बागरे बता रहे थे कि एपिलेप्सी के बारे में। चलते हम अपने स्टूडियो गेस्ट की तरफ। वेलकम टू द प्रोग्राम Denise.
Hello, thanks for inviting me.
And we've also got Will Butterworth here. Welcome to the program, Will.
Hello, thank you for inviting me.
Denise, in the first half of the program, Dr. Bagre was speaking about epilepsy. Can you tell me a bit about the tests associated with epilepsy?
Yeah, there's a few tests that we do to help confirm a diagnosis of epilepsy. We will do an EEG, which is registering the electrical activity inside the brain. We will also do something called an MRI scan to try and look for whether there's any structural problems within the brain. And we also do an ECG, which is a heart trace, just to make sure that the episodes that are happening aren't cardiac events and that there's no other cardiac problems there.
And how long do the tests take? Do people have to go to and fro hospital, or is it a simple case where they go once and everything's done all together?
Unfortunately, EEGs are very easy and very quick to be able to obtain, so they tend to get done very quickly, and usually EEG will take about half an hour, that's all. MRI scanners, there's not so many of them, so we need to book people in for appointments, and that can take a little while to come through. But they're readily available for everybody, but they're just not quite so speedy to get those investigations done. And an MRI scan can be quite scary for people because you have to go into a big machine. So we need to make sure people are prepared for that as well.
And if we've got any viewers that are worried and would like the test, the best way to go to is the GP, is it?
Go to the GP and they can refer through to specialist centres to make sure that their epilepsy is investigated properly. And then when they see the specialist, they can talk through the investigations and what they'll involve. And hopefully that will allay some anxieties about those tests.
And can you tell me a bit about sudden unexplained deaths in epilepsy?
Yeah, unfortunately about 1 in 500 people with epilepsy will die from sudden unexplained death in epilepsy. We don't quite know why it happens. We do know there's a number of risk factors. So people that are having frequent seizures, having lots of abrupt or lots of medication changes or missing medication. Alcohol can be a trigger as well. We don't know quite why it happens, and it's very similar to cot deaths in babies, that some people with epilepsy will die due to their epilepsy. And we think it may be a cardiac or respiratory problem that causes the death.
In the first half of the programme, Dr. Bagre spoke to us in quite some detail about epilepsy and that young children, and it's more likely to happen in older adults. Can you tell me a bit about the trigger points in epilepsy? What would trigger it off?
There's lots of different causes for epilepsy, so that may be down to a structural problem. It may be down to infections, it may be down to tumours, lots of other physical reasons why people develop epilepsy.
One of the things he mentioned was in pregnancy to avoid things like head injury, or try and be careful around that as well.
In what? Sorry, what?
In pregnancy.
In pregnancy. Women with epilepsy during pregnancy need to be careful to make sure that they're closely monitored, to make sure their seizures don't increase, that their medication is closely monitored. And there's also some medications that we try to avoid in women with epilepsy during pregnancy to make sure the baby's as safe as possible.
And in terms of writing down the seizure and the length of it and how it happened, how important is that, and why do patients have to do that?
It's really important. We do ask people to keep seizure diaries.
You have
and we give people diaries. You can get these from your specialist. If you haven't got a proper diary, just use a normal diary. You're not actually keeping track of how many seizures you're having, how long they've lasted, any particular trigger points for seizures. And we do know that a lot of people will have more seizures if they're tired, if they're physically unwell, if they've missed medication. So there's lots of triggers. So identifying triggers is also a really important way of managing somebody's epilepsy. And keeping a diary as well also helps record if changing any medication changes or treatment changes has helped reduce the seizures and how often they're happening and how severe they are. The seizure diary is really, really important.
And that would help in terms of managing the condition?
Yeah, and over the years we can see what different drugs people have responded to, different treatments, And identifying the triggers, if we can manage some of the triggers around stress and anxiety and other physical causes for seizures, then that will actually help reduce the amount of seizures that somebody will have.
Okay, thank you for that. And one of the other things I think that was mentioned earlier in the programme is if you have a seizure, sometimes you may not know about it. It might be kind of a blank episode where you're sitting there and somebody's calling out your name, but you may not realise. What happens in that instance?
What we do is we still get people to try and record those episodes. They may have noticed that if they were watching the telly, a little bit of the TV programme, they've come back later on in the TV programme. So they may not be aware of the seizure, but if they document that they may have had a seizure at that point, and that's where carers really come in as well, because the carer may be able to record those seizures as well.
We also spoke about how it has an impact on kind of normal daily routines. Now, in terms of people driving who may have epilepsy, are they recommended to drive?
No, you're not able to drive if you've had a seizure, and people need to be seizure-free for at least 12 months. Some people where they don't lose awareness, there may be some other ways that they can get their driving licence back if we know that they're not going to likely to have a seizure and lose awareness when they're driving. Those are things though that are determined by the DVLA, but they will seek advice from the medical people that are involved in your care to see whether it's appropriate for you to have your driving licence. However, because people with epilepsy aren't allowed to drive, they are entitled to have a free bus pass.
And in terms of, if somebody has a seizure in front of you, if you happen to be there, how can you best support that person? Or what's the advice for the general public if somebody's around or you're sitting on a bus and somebody has a seizure next to you?
Obviously, depending on the type of seizure, it depends on what the management is of that seizure. If somebody's having quite a severe convulsive seizure, you need to make sure their head's protected and that their head's safe. So maybe putting a pillow or a coat underneath somebody's head. Don't restrict the movements of the person that's having the seizure. You may cause them harm by doing that. Also make sure, there used to be an old theory that you should put a spoon or something into somebody's mouth. Do not put anything into somebody's mouth.
Is that just a myth then?
That's an old myth, yeah, and actually it could be quite dangerous for both yourself and the person that's having the seizure, so don't do that. Make a note of the time to make sure the seizure doesn't go on for too long. If the seizure goes on for more than 5 minutes and this person hasn't got a management plan that says anything any different, you should look at whether you need to phone an ambulance for that person. A lot of people with epilepsy, we do recommend they wear some sort of medical alert jewellery, and that should say whether that person's got epilepsy, so you know that this person is known to have seizures. So that's something else that you might want to look for. And after the seizure's finished, place the person on their side or into the recovery position, and that's the safest place for them
safe
to
as
be.
possible.
Yeah.
And in terms of, do you recommend patients who have epilepsy that they carry out kind of some risk assessments in terms of what they're doing and what they'll be doing during the day, etc.? Yeah,
sometimes if you're doing a new or unplanned activity, something different, you need to look at what the potential risks are around if you had a seizure in that situation. And most situations can be overcome just by thinking it through and putting some basic steps and measures into place. We do encourage people with epilepsy to have as wider activity and live as normal a life as possible, just being a little bit more careful than maybe other people need to be.
Well, can I ask you a bit about diet and how important diet is in epilepsy? It was touched on in the first half of the programme with Dr. Bagre, but can you tell me a bit about diet?
Yeah, essentially people who have epilepsy don't have any need to have a different diet than anybody else. What we encourage people with epilepsy to do is, through a program of self-management and well-being, is to look at what they're eating and have a healthy, balanced diet. So essentially there isn't any difference. There are some foods and perhaps drinks more so, which might affect some people with epilepsy more so and differently. Some people say that caffeine can affect them, but everybody's very different and it doesn't apply to everybody.
So there's no standard in terms of it, is it?
Not as such, no. We know that alcohol can affect some people with epilepsy quite adversely, and some people who have the condition won't drink any alcohol at all. For some people it doesn't have much of an effect and they are able to. What we do know though is that excessive alcohol does cause problems for people and can be a trigger for seizures. But that's advice that anybody would give to anybody to either avoid or reduce alcohol. It's certainly not something that we would promote anyway. But in terms of a diet, generally it's a healthy, balanced diet. For some people with epilepsy, there is something that's called a ketogenic diet. And that's a diet that is used really for children, although there are some adults who do use it, and I know there are trials at the moment being looked at with that. This is a diet which is high in fat and lower in carbohydrates and protein.
A bit like the Atkins, I think, Dr.
It's called that.
Bagri,
it's compared to the
described
Atkins
it
diet,
as.
but it is actually quite different, and it's quite a difficult diet to keep to because things have to be measured and weighed out generally. And essentially at the moment it's really only used for children up to about 18, and that's something that people could look at through advice through a nurse, and then they would see a dietitian for that. But in terms of the actual diet, I know that Kazam actually is on the diet, so he's probably better placed to talk about how the personal experience is for him with that.
Kazam, how do you find being on that diet? How do you manage it?
It is very difficult, I must admit. It's not an easy diet to keep to. You have to cut out quite a lot of food which you would normally have, such as bread, milk, butter, chocolates. So it's something, and everything has to be measured. On top of that, you need to see a dietitian on a regular basis, and your sugar levels need to be monitored on a regular basis as well as your ketones, to see whether you are producing ketones too. But
and how long have you been on the diet?
I've been on it for about 6 months now. I have actually lost weight on it, but the idea is not to lose weight, it's try to produce ketones which will then prevent me from having epilepsy attacks.
And have you found it's helped, or is it early days yet?
It's still early days. I have had one at the start, but since then it has calmed down. But as I said, it's still early days, but it's very hard because you can't eat the food which you'd normally eat. And it's trying to eat food which you can eat on a regular basis. It gets quite frustrating when you can't eat food which you normally would like to eat. You can eat meat, but then, you know, for example, we'd eat chapatis and stuff like that. What would you eat? Chapatis or bread or rice? You can't eat any of that. So what would you eat with that? So you have to think about salads and mix it together. So
there's a lot of preparation and thinking about it.
And everything has to be measured, and you can't go above, in my case, 30 grams of carbs a day. 30 grams of carbs a day. So it's quite difficult. You can't eat no cereals or anything like that. So it's quite hard, must admit.
And would you say that you encourage people to keep a diet, a diary, in terms of their diet? So if there is any trigger points that are, you know, to do with caffeine, etc., can they?
Yeah, I mean, as already been mentioned, in terms of keeping a diary, that's really useful for all aspects of anybody's life who has epilepsy, which would include keeping a record of perhaps the sorts of things that they've eaten, and if they've noticed that something has possibly caused it, or they noticed they had a seizure around having eaten something, it may be something that the specialist might want to think about. But we would advise that anybody keeps a diary for their general health anyway. But just with regards to the ketogenic diet, while it's very successful, and lots of people that have gone on it have had really good results, and some people have actually gone on to not having any more seizures, so it is very positive.
That's super news.
But the sort of caveat that anybody would say with the diet is that it isn't just a case of changing what the person is eating. If you have a family, you have to think about the impact on everybody else in the family and what they're eating, and questions as to, well, why are they eating chocolate biscuits and I can't eat chocolate biscuits? And if you have a big family, that's going to be a bit tricky to balance that and manage that. It's not impossible, and people do it, but people need to consider that when that is offered as an option, the diet, that it isn't ever so simple and straightforward, and it does have quite a significant impact, and people would need to weigh up the benefits of that within the whole family life.
And in terms of how do you, who do you choose in terms of to suggest that diet to? Is it suggested to everybody?
It's it would be looked at more about an individual's condition, and that would be in discussion with their specialist nurse or consultant. A variety of options would be looked at, whether medication has worked or not, and then as with any of the different treatments, that things might be explored at certain points, but it's not something that anybody would suddenly say, oh, you've got epilepsy, try this diet. It isn't that sort of straightforward.
Okay, yeah. Well, Denise mentioned earlier that they would encourage people who have epilepsy to wear some kind of jewellery, etc. So if there's a seizure, that may help. Do people tend to carry things like epilepsy cards or anything on them that will tell you a bit about their condition?
Certainly most of the people that I know who have epilepsy carry some sort of identification which shows that they have epilepsy, and it may be a card, it may be a piece of jewellery, but most people do carry something. As with any health condition, if somebody has a condition that people need to know about, should somebody be unconscious, you would carry that sort of information with you. And certainly there's a whole range of different items that people can buy and get through the internet. There are some watches that people can get that actually, if they have them, it looks a bit like a Swatch watch, where they can store all of their medical information on it, and with any Android phone it can be swiped on that phone and all of their medical history will come up with that, and people can find those on the internet, and they're not very expensive.
And well, you're the manager for, is it Central England?
Yeah.
Is there a website that if people wanted further information that they could go on to and find out more information about these kind of items?
Yeah, I mean, I cover the central area. I'm not the manager of that bit. It's just my title. It sounds very grand, but I cover that area. Epilepsy Action has people like me across the whole country, and on the website, which is epilepsy.org.uk, people can access a whole range of information, support and leaflets about epilepsy, about seizures, about medication, about diaries. So all of that information is there. There are other websites as well. Our information that we provide has had to go through what's called an information standard, which is, if you like, a rubber stamp of quality. So all of our information that we provide, we're able to provide to health services as well. So there is a raft of information available on the internet, or we have a helpline that people can call as well, and they can get information sent out to them if they want, and I'm happy to give you the helpline number.
One of the things that Kasim spoke about earlier was the impact of epilepsy on his daily routine. How would you say that in terms of having epilepsy and living a normal life?
It's very difficult because I would be foolish to say that if somebody has epilepsy, they would be able to do everything that anybody else can. And that would be naive to try and do that. Certainly, having epilepsy restricts a lot of activities, certainly with regard to driving. If you have certain seizures, you can't drive. It's as simple as that, and that may impact on the ability to do certain pieces of work, to go on holidays perhaps. So it does affect people, and I would be sort of silly to say that it doesn't. What we do try and encourage people with, though, is to accept that it is a condition, but it doesn't mean that somebody's life has to stop. There are lots of activities that people can still do. It doesn't stop people from doing things. As Denise already said, it might mean that people just have to think a bit differently about how they might do things. And if they are doing an activity where they might be at risk of a seizure, is it something they can do on their own, or do they need to make sure that there's somebody with them? So it does affect people, certainly, but it doesn't stop people from living a normal life and doing day-to-day things. And
sometimes people often feel that a diagnosis may stigmatise them, and there's a taboo around epilepsy. So is there anything that you want to say around the stigma that people may come across?
Yeah, epilepsy is an interesting condition in that it's an unseen condition until somebody has a seizure in front of you. So you could be walking along the street and be surrounded by tens of people. You don't know if any of them have epilepsy, so it's a very unseen condition. And because of that, it's not very well known about. It doesn't get a huge amount of coverage in the press. And I think also because of all of that, it carries a huge amount of stigma. I think one, because people are scared of what they should do if somebody has a seizure. And I know from people that I've met, when you talk about epilepsy, immediately you can see them that they're thinking, please don't have a seizure in front of me, because I don't know what I should do. And the work that we do is to try and encourage people to understand, in actual fact, it's not very difficult to look after somebody who's having a seizure. Basic first aid is something that comes into play. But it certainly does carry a lot of stigma, and people are discriminated because of it, and there's a number of very sad stories where people have been kicked off buses because they thought that they were drunk when they weren't at all. There was around epilepsy. People have been discriminated at work, being told that they can't do certain jobs because of their seizures. We encourage employers to work around people's seizures and their condition, and look at it as another disability which can be worked with, and reasonable adjustments can be made.
Thank you all for coming onto the programme and speaking about epilepsy. I just want to ask all of you, is there, Will, any final messages that you want to leave for our viewers watching the programme today?
Yes, I would say that anybody who is suffering from epilepsy or has the condition shouldn't feel that they're on their own. There are lots of people who have the same condition. There is help available, there is advice available. What I would do is say to people is to not be frightened to talk about your own epilepsy or your friends or family's epilepsy, because support is there, and the more people talk about it, the less stigma and discrimination there will be with regard to the condition.
And Denise, you're a clinical nurse working in this area. Is there any messages that you want to leave for our viewers?
Yeah, I'd like to say that if you or one of your family members have got epilepsy and you're still having seizures, then go to your GP, ask to be referred on to a specialist, and see if there's any new treatments. There's been lots of new treatments, and the approach to epilepsy services has moved on over the last few years. So I'd ask them to seek help and try and improve their epilepsy.
And Kasim, any final messages जो आप हमारे viewers के लिए रहना?
I'd just like to say that people just live their life as normal and not get frightened about the illness at all, and just enjoy their life as like I do, and not get frightened about their illness at all, and just be happy.
नाज़रीन, ये थे हमारे गेस्ट जिन्होंने आगे आज के हमारे प्रोग्राम में हमें एपिलेप्सी के बारे में बताया, और जो इनका की मैसेज ये है कि अगर आप एपिलेप्सी से सफ़र करते हैं तो आप को वरी होने की ज़रूरत नहीं है. बहुत सारे न्यू ट्रीटमेंट्स अवेलेबल है जो आप को मदद कर सकते हैं. इन्होंने ऑल्सो ये एक्सप्लेन किया कि जो हमारी कम्युनिटीज़ में कभी कभी स्टिग्मा टबू अटैच्ड होता है एपिलेप्सी के बारे में, अगर आपके पास एपिलेप्सी है तो आप स्टिल एक नॉर्मल लाइफ जी सकते हैं. तो ये ज़रूरी है कि अगर आपको शक हो कि आपको सीजर्स एक्सेट्रा हो रहे हैं, तो कभी कभी दिमाग में ये ख्याल आ जाता है कि मे बी वो जिन के साथ रिलेटेड हो या काला जादू एक्सेट्रा. बट बहुत इंपॉर्टेंट है कि आप अपने जीपी के पास जाएं, उनको उसके बारे में बताएं कि आपको ये सीजर हुआ है, तो वो आपको जो रिफ़र करेंगे, आपको एपिलेप्सी के टेस्ट होंगे और वो डायग्नोज कर सकेंगे. ये भी हो सकता है दैट मे बी इट्स नॉट डायग्नोज एज एपिलेप्सी और वो बस एक सीजर ही हो, बट एटलीस्ट दिस वे वो रूल आउट कर सकते हैं कि आपके पास एपिलेप्सी नहीं है. इसी के साथ नसरीन आपसे लेती है इजाज़त अगले हफ्ते तक के लिए. अगर आपने कोई ऐसी टॉपिक हमारे प्रोग्राम में देखनी है तो आप हमें ईमेल कर सकते हैं at healthmatters@thenurtv. खुदा हाफिज़.